What's up, YouTube fam? Madison Kleckler here, the fitness doula, perinatal fitness coach, and labor doula, coming at you to talk today about how you can reduce your risk of tearing during birth. First, I want to make a quick note that there are some factors that are out of our control, like how big your baby is, how fast your baby comes out, and certain genetic things that we can't really control when it comes to preventing tears. So while they're not 100% preventable, these tips will help you reduce your chances of having a major tear. One huge help in preparing your perineum and the muscles to stretch and give way for a baby to come through them are perineal massage and perineal stretching. So especially if you have had a previous tear with a previous birth or an episiotomy, we want to make sure we massage that scar tissue out. But either way, this is a great way to get your perineum ready and available to stretch. So what you're going to do is just gently massage your perineum. You can do up, down, side to side, just moving those muscles and tissues around and creating a little more laxity in them. And then what you can do for the stretching portion is just stick your fingers right here in the vagina and stretch a little bit down and a little bit around, just like you would if a baby's head was coming out. Just very gentle. Now, perineal massage and stretching can be done in the third trimester. There should be no risk to going ahead and starting with that in your third trimester. Another way to prepare the pelvic floor for birth is to learn how to relax your pelvic floor. So I've got a couple of videos back in my YouTube channel about it, so I'll quickly go over. On your inhale breath, you should feel your pelvic floor relax and drop down. Now, there are a couple ways that you can feel this a little more effectively. I'll link one of those videos. Another way to reduce your chances of tearing are to perform stretches that open up the pelvis, exercises that strengthen the glutes and the outside of your thighs, and mobility exercises for your pelvis as well. Now stay tuned and make sure you subscribe to my channel because I'll be going over some specific exercises with you in a later video. But one thing you can start doing now is to grab one of these balls and doing some hip circles on it just to aid in relaxation and opening of the pelvic floor. Another way you can aid in relaxation, preventing tears, ripening the cervix, and preparing your uterus for birth are to drink red raspberry leaf tea and or take evening primrose oil. Now, these two things are not recommended before about 37 weeks of gestation, and make sure you talk to your provider before beginning any supplementation or taking any oils. Another way you can reduce your risk of tearing is to vary your birthing positions. So we often see people birthing on their backs, which may not be your best chances of minimizing tearing. You can birth in many different positions, including upright and all fours, so that you can aid in baby coming out and your pelvic floor relaxing as well and allowing for that baby to come through. Stay tuned for more videos on this. And last but certainly not least, this is something you should talk to your provider about, but there are some providers that will provide warm perineal compresses. So what they would do is just warm up a towel and press that towel onto your perineum in between contractions or during the pushing phase. Now, the warmth will help the muscles relax and soften to allow baby to come through. Those are all the tips I have for you today. Thank you so much for watching, and make sure you like and subscribe for more tips from the Fitness Doula.